Hello and welcome. I'm your host, Neil Howard. Thank you so much for joining us for another segment of Health Professional Radio. We'll be speaking with Dr. Rakesh Amin in this segment, joining us here as a psychiatrist to talk about the toll that schizophrenia takes on caregivers. He's also going to talk about how caregivers of schizophrenia patients can best support themselves as well as their patients and help patients establish a very successful treatment plan. Welcome to Health Professional Radio, Dr. Rakesh Amin. Thank you.
Thank you for welcoming me.
Now, it's my understanding that you're an Oklahoma native and you pursued an undergraduate at University of Texas in Austin, correct?
Yes, sir. I born and raised in Oklahoma and moved on to University of Texas undergrad and went on to medical school from there and went to a European medical school. And now I'm a board-certified psychiatrist for the last 10 years in Nashville, Tennessee.
Well, briefly, tell us what it was about psychiatry that interested you.
Yeah, it's a great question. A lot of people have asked me about from students and residents that I teach or just colleagues or friends. I actually went to medical school apart from, being influenced by my father, who was a anesthesiologist, and, of course, sacrificed a lot moving on from India to England to all the way to America. And was exposed to anesthesia at a young age, went into the OR, a few times with him and kind of fell in love with medicine in general and just fell in love with taking care of people and being there for people and whatnot. And I felt like everything was exciting in the OR on the other side of the curtain from what he was doing in the surgery's hands. But went to medical school, went through the rotations and clinical rotations, learned a lot from my preceptors and other colleagues and peers of mine and around the United States. I was in New York City and the downtown Brooklyn and Manhattan areas, and also moved on to Chicago and then Nashville for like about the last year of my medical school career. And actually psychiatry was my last rotation. And I met my mentor there, John Dowd. He actually is a practicing psychiatrist here still. And he was a big pharmacology guru at that time, but also very much business savvy, but also really showed me the way and paved me the way of how interested in psychiatry can be and how versatile it can be. I'm not a routine kind of person. So I love differences in psychiatry and what it can portray on a daily basis. And going in from working in the mornings to an inpatient facility and seeing very acute and chronic cases of patients people going through a very, very tough time. And also just going into my clinic and seeing patients, on a continuum of care, and seeing those differences and educating colleagues and future psychiatry professionals in the future has also been very, very gratifying.
When it comes to schizophrenia, what's the overall prevalence here in the United States?
It's a wonderful question. Schizophrenia, very chronic mental disorder, of course, chronic and very severe mental disorder. Right now, the prevalence is 1% to 1.5% of the 350 million people that we have in America. That's kind of equivalent to about 3.5 million people total that are diagnosed and actually seeking care for that illness.
We don't hear a lot about, we don't hear anything about the toll that being a caregiver can take, just in general, let alone for a schizophrenia patient.
I agree with you, 100%, Neil. I think the caregivers really are impacted by either their loved one that's inflicted by schizophrenia, or it's a caregiver role in that partake of taking care of a human that's struggling with such a chronic and severe mental illness. We know the caregiver role. We've heard about caregiver roles, and when it comes to dementia patients and taking care of the elderly and whatnot, or the disabled, when it comes to schizophrenia, it's a whole different ballgame for those caregivers, but also for the patient, of course, as well.
Now, obviously, the caregiver has to be at their best in order to render the best care to the patient. How can caregivers pay more attention to themselves in order to ensure a successful treatment plan for the patient?
That's a wonderful question. I think as a psychiatrist, I've been stressing this to myself and peers and colleagues of mine as a person that's treating such patients and treating such family members and caregivers and educating them as much as possible. We have to take care of ourselves before we can take care of others. Self-care is going to be very vital. So if it's 10 to 30 minutes or an hour in the morning or in the afternoon or whatever time that you can allot as a caregiver role dealing with such an illness, I would definitely put that in your schedule. But also educating yourself as much as possible from the treatment team with your client that has unfortunately dealing with this illness is going to be very impactful for you, how to cope with such an illness, how to cope with somebody that you're going to get very close to with, personally intimate with, and trying to take care of such a client that, unfortunately, that client or that patient or that human is definitely not having any kind of control of what the unfortunate brain is going through at that time.
Mental health treatment plans are wrought with non-adherence on the part of patients and possibly caregivers too, forgetting or maybe neglecting based on their mental health, their exhaustion at that time. What are some of the treatment options that can help improve patient adherence, reduce some of that stress, and allow freedom for both the patient and the caregiver?
Great question. I'm a big advocate of this treatment option, which is a long-acting injectable of an atypical antipsychotic. There are several tools now, several choices now that we have this in 2023 with more research going into schizophrenia, more tools in terms of treatment options for our clients that are struggling with such an illness. The benefits of long-acting injectables, such as Aristata, can reduce relapse rates for those patients that are struggling with such an illness. They can improve medication adherence on a daily basis. You're looking at a simplifying treatment regimen. Unfortunately, some of our clients with schizophrenia can have 1, 2, or 3 different psychiatric medications. And those could be those medications that are literally targeting those symptoms for schizophrenia. So to reduce that pill burden for that patient and that caregiver to remember to take either once a day, twice a day, sometimes 3 times a day, this could be a huge advantage for that patient. Having an injectable, if that's an option of once a month, once every 2 months, is a great option for patients to, again, reduce that relapse, improving the adherence or compliance to those medications and that regimen. Obviously, underwhelming that patient in terms of simplifying that treatment regimen for that client. And obviously, the flexibility and independence. You get a little bit more autonomy to choose to partake in that treatment plan and that treatment option. And there's so many different tools now that we can help with such of those patients that are struggling with this illness that can really, really benefit from a long-acting injectable for them to sustain a quality of life, to be a very well-respected individual in the community, to even meet their goals. And again, going back to that caregiver question, I think that's going to be really impactful for that caregiver to highly be educated on such treatment tools, treatment plans, treatment meetings, to really get more and more in tune to help that patient succeed and sustain symptom control, especially through their early diagnosis and that intervention.
Is there anything that you'd like to add for our listeners?
I would definitely like to add schizophrenia is definitely a chronic and severe mental illness. But I feel with education, with more clinical experiences, with more of these resources that are out there, that everybody part of psychiatry would be more in tune to receiving this education and reducing the stigma by providers, by patients, by caregivers, anybody that's involved in the healthcare community that can really strengthen most of the community, that can help these patients to strive to be upstanding citizens in the community, but also reach their goals. And I've seen this from my own eyes and my own experience over 12 years of doing this. I have seen patients with schizophrenia and their caregivers and their loved ones be a very successful treatment part of the team, but also being very successful and beneficial from treatment options such as a long-acting injectable.
Well, Doctor, I appreciate you joining us here on Health Professional Radio. Thank you so much for your time and this information, and hopefully you'll return.
I appreciate it, Neil. Thank you so much. I would love to come back anytime possible.
Great. You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Rakesh Amin. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. And be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.